If you are looking at doing hormone therapy sometime in the future, tracking your symptoms is so, so important. Looking at your sleep quality, looking at your overnight glucose patterns, looking at your mood, your anxiety, and timing of symptoms after starting or changing hormones. Really, really important. You've got to be paying attention to what your body is giving you as far as feedback. It does speak to us. It is letting us know whether it's happy or it's not, or it needs a little adjustment or a lot of adjusting. In this case with my client, where she changed a whole different formula. So she went from oral to vaginal progesterone, and that, as of this recording, is working for her. And I encourage you to bring these patterns and this conversation, not just the labs or the data, to the doctor's appointments and to reinforce your symptoms and how you're feeling with them. That is the true data, especially in perimenopause. Lab values don't matter quite as much because, again, there's so much erratic changes going on, during the cycle changes and the hormonal shifts, along with the insulin resistance and sensitivity. Symptoms matter. And also to talk, to bring better questions into the exam room when you are meeting with your hormone specialist. Maybe asking, what form of progesterone is this? So if they're prescribing something, ask what it is and discuss if this is your best option. And, one of the things that I do note, and I know we do this a lot with diabetes, is sometimes we got to experiment a little bit. And the whole adage with a lot of doctors and specialists is to go low and slow. And that is always the best because you can always add more hormone or up your dose or whatever, but just starting low and slow and waiting for the response, because within a week or two, your body's going to be talking and giving you some feedback. And another question is, how might this affect insulin sensitivity? A really, really big question. Not all hormone specialists are up to date or even have the knowledge to treat women with that have type 1 diabetes, insulin-dependent diabetes. So that is something you definitely have to walk into the practitioner's office with these questions so that they're aware that not only are you looking at hormone symptoms that you're tracking, but you're also looking at blood sugar symptoms and data and trends. So that is really, really important because, again, we want any sort of hormone therapy we bring in to help, not to hurt or harm. So we want it to help us and to support us. Another question is, what are our options if this doesn't feel supportive? So again, asking about the different formulas, the different types, again, talking about that lower formula strength to begin with. Again, all these things to know about, to be aware of. So don't assume it's going to come up in the doctor's office. Have your list of questions ready and making sure that everything is looked at, answered, and that you walk away feeling understood and that your questions are received. And in my upcoming book, this is definitely a space that I'm going to be making for these outlier experiences. Again, these are not things, as far as the progesterone intolerance it's more common than we think. And it's definitely something that needs to be spoken about and addressed and supported for those of us that may go through that. And this will definitely be one of many things that I will be covering in my upcoming book, helping women just like you feel less alone when things don't go quite as expected, right? So this isn't about rushing into hormone therapy. It's about understanding the types, what it's going to do, some possibilities of what it could shift or cause a little bit more adjustments needed in the case of progesterone. Estradiol is definitely in the same conversation. We're not talking about that specifically today, but being aware of the type of hormones, how it's going to respond in your body, why you're taking it, and the dosing and the formula. All those are really, really important things to know. And it's about noticing the patterns, staying curious, and advocating for care and for a hormone doctor and other specialists that are going to listen to what you need. And just remember, you're not alone.